Thermography actually gives you more information than you can get from a mammogram. When you have a mammogram, it's an x-ray of your breast tissue. So by the time something is big enough to bounce off an x-ray, that's not early detection of breast cancer. It's already breast cancer. On a thermogram, however, the camera is a heat detector. So it's basically turning your body into a weather map. So you can see abnormal heat patterns years before a tumor develops. Because the very first thing that cancer has to do is it has to have a blood supply to feed and grow a tumor. And all of that metabolic activity gives off more heat. And we can see those thermal changes on the thermography. So you have a long window of time where you can make lifestyle changes and healthy changes to avoid and interrupt a potentially cancerous process. As a screening tool, it does no harm, and our screening tools should never do any harm. And that's not the case with mammograms. Breast tissue is compressed, breast tissue is damaged, women suffer a lot of pain. In addition to the radiation exposure, particularly at perimenopausal breast tissue, causes a lot of damage, and that radiation exposure is cumulative. So by the time a woman is 50 years old, if she has already had 7 mammograms, that doubles her risk of developing breast cancer. So we've caused damage by having mammograms. So when you come for your thermography, you come in and there's a history that's taken between the two of us. You fill out some paperwork on the iPad, it's all in the cloud, and we go over your whole history. The room temperature is 70 degrees. You have to sit undressed from the waist up, and you're just sitting on a chair with your hands on your hips so you can cool off as much as possible. You have to sit like that for about 15 minutes so your body gets rid of any artificial heat from your clothes. And then we start taking the pictures, taking the pictures is the shortest part. There's, 8 or 9 different views. Sometimes women have other body parts. They do their upper body, which includes thyroid assessment, dental, sinuses, circulation to the head. And that's sometimes added on as well, in addition to the breast screening. Sometimes people also come for pain evaluation. They suffer from fibromyalgia, for example, and we can do other areas if a woman's having back pain or leg pain or anything like that. And then she gets the results by email, and after she gets the results, we have a phone consultation to go over all her results, what it all means, what kind of follow-up she should be having in terms of, does she also need a breast MRI or a breast ultrasound or a sure touch exam. We have the time to go over all that so she understands. And then we go over lifestyle things that she could also implement to try to improve her breast health. I think that it makes sense to start your breast cancer screening at the same time that women normally start getting pap smears, because the most aggressive breast cancers are found in women in their late 20s and early 30s. And so if they already have breast cancer by the time they're in their early 30s, they've started that process 8 to 10 years before. So if we start screening, in the early 20s, then we're going to see those changes that could potentially indicate a cancerous process, hopefully before the cancer develops. So, and then, in the younger years, you could space it out a little bit, every 2 years, every 3 years. And then as you get older, move more toward an annual exam. So by the time a woman is 35, she should be having annual thermographies.